This is Donna Craig, Student Assessment Video 1. I'm scanning the room right now.
Up and down.
Up and down. To make sure that to verify that the room has no hidden notes and no cues as to what I should be doing next. And all my stuff is in this bag as I'm going to need it, I will pull it out. And the only thing I'm not putting in there is the cup of water for when I get to the thyroid. And I will check to make sure I'm pointing in somewhat a right direction so you can see his arms and his feet for the moment. And we start with the skin, and observing, I note that he has a light tan and a little sunburn on his forehead. He has significant hair distribution that is typical of a male. And we'll start with his arms. And temperature is warm. It is dry. His skin is smooth with the hair. And I'm not noting any lesions on this side. There is, of course, a tan line. On this side, once again, there's the hair, there's a freckle. There is a cut next to his nail from a box, and his skin is again dry and warm. And there's the tan line. And turgor is good. And then looking at his legs, I note that they are smooth. There are a couple scars here. He has calluses on his knees from being on the floor. This foot has a Band-Aid covering a broken blister that broke in his shoes. Turgor on this foot is good. Temperature is a little cooler, but it's still dry and smooth and turgor. Okay. And then this one, there are a few intact scabs and scratches in various stages of healing, and his feet are, his legs and feet are the same temperature as the other side, and the turgor on this side is good. And while I'm down here, his toes are a little bit yellow and thick, and capillary refill is less than 3 seconds on that foot. And these nails are also a little on the thick side and beginning to yellow. And capillary refill is less than 3 seconds on his hands. His nails are clean and white. They are cut short to help prevent injury. There is some dryness around the cuticles and a few cracks. And there's something I forgot about before. Capillary refill is less than 3 seconds, and there's a little nail here. There we go. And less than 3 seconds all the way across. And then I want you to go like this with your fingers, one at a time. No, this way. This way. Okay. And, yep, next finger. Next finger, next finger, and your thumb. And I can note that the nail angle is 160 degrees, and all of his fingernails and toenails are adhering to the nail bed. And now I'm going to move the camera up a little bit to get to his head. Right. You can tell I'm not a professional videographer. Oh, where'd it go? No! Where'd it go? It's still recording. Okay. Okay. Oh, and now I look at his hair. And his hair is clean. There's a few wisps of gray. There's the beginning of some male pattern baldness. But the hair that's here is in very good condition. Face. And now I need this. We're going to test some sensations. This end is sharp. This end is soft. Okay, tell me which it is.
Sharp. Try looking smooth. Smooth. Sharp. Smooth. Smooth. Sharp.
Okay, and then I'm gonna check your TMJ, clench your teeth. Okay, and that's strong. Open and close your mouth. Now open your mouth and wiggle the jaw side to side. Okay, and that's tested the sensory and motor functions of the trigeminal nerve. Now, open your eyes for a few minutes. Purse your lips like a kiss. Okay, puff out your cheeks. Smile without your teeth. Smile with your teeth. Frown. Okay, relax your mouth, your face. Close your eyes. Raise your eyebrows. Okay, and that tested the facial nerve. And now we go on to the eyes, which would be, we would be testing vision with a Snellen chart for distance, both with and without glasses, and we would be testing reading vision with a Rosenbaum card for reading at about 14 inches for close vision. And then I need our index cards. To test peripheral vision, and these are blank. I want to make sure you see that. Tell me when you can see the Q-tip.
There.
I can't go out far enough.
There.
Okay.
There.
Okay, now switch eyes. Tell me when you can see it again.
There. There. There.
Okay, and that was the test for peripheral vision, and that tests the ocular nerve. Then I do the 6 points, follow my finger. Okay. Follow my finger. And that tests the oculomotor, trochlear, and abducen cranial nerves. And then I get my flashlight out. Oops. Don't need this yet. And okay, pupils are equal. They're equally reactive to light. Now focus on the door, out that door for a moment, and then switch your vision here. Now follow this in, and his eyes are, pupils are equally reactive to light and accommodation. And then there it is. Check his eyes. Always like my glasses. And I'm able to visualize the cornea and see the vessels. And get the fovea centralis and the optic disc and the macula. Okay, now we go to this side. Place. Wow, and there's the red reflex again, and the veins and the fovea centralis and macula and optic disc. Okay. Okay, I was turning the page, sorry. Now we're going to look at the ears. And I inspect the mastoid area and make sure he's clean behind his ears and the outer ear is clean and healthy. And I inspect the meatus and the ear canal. I know. I'm trying to see your eardrum. There we go. And I'm able to see the tympanic membrane is intact. I can visualize the malleus and the cone of light. And there's a little earwax in there. And then come around, inspect the mastoid area, make sure everything's good here, the skin's healthy and intact, and the outer ear. And then look in his ear. And this one's a little tender, but I can visualize the tympanic membrane, the cone of lights at 5 o'clock, and I can visualize the malleus. A little irritation in here as well. And then we do some hearing things. Okay, first, repeat after me.
Repeat after me. Today's a beautiful day.
Okay, and now we're going to use the tuning fork. Can you hear that?
Yes.
In both ears?
Mm-hmm.
Okay. And then we're going to go to the mastoid bone. Can you hear that?
Yes.
Tell me when it stops.
There.
Can you still hear it? Okay. And then mastoid bone on this side. Can you hear it?
Yes.
Tell me when it stops.
There.
Can you still hear?
Yes.
Outstanding. And that tested the ocular, or the cochlear branch of the vestibular cochlear cranial nerve. ears, nose. Where'd it go? Oh, that didn't work. Get this on again. And his nose is straight, his septum is straight, his nares are open and clear, and he has significant hair, so I'm using the otoscope to visualize the turbinates, and I can see them here. Thank you. And then the mouth. And the flashlight. Okay, open your mouth. And the buccal mucosa, put your tongue out and down. Buccal mucosa is pink and moist, and I can visualize Stenson's duct on that side. Mucosa is good on this side, and I can visualize Stenson's duct on this side. Raise your tongue. And Wharton's duct is down here, the tongue frenulum, and there's a lower frenulum and an upper one. Thank you. Now stick out your tongue again and say ah. Say it again. The uvula and the soft palate raise evenly. That tests the glossopharyngeal and vagus nerves, which also innervate swallowing and the gag reflex. Now stick out your tongue and wiggle it side to side. Thank you. That tests the hypoglossal, which is also used for speech as well as manipulating food as we chew. The lymph nodes, post-auricular lymph nodes, occipital lymph nodes, then the surface and deep cervical chains, and the submental, the submandibular, sublingual, and the submandibular, and then the supraclavicle, and no nodes or swelling is noted. I forgot the smell test. Boogers. Okay, I need you to close your eyes. Close one nostril. And what is this?
Vinegar.
Okay. And other nostril. And open. And what is this?
Chocolate.
And that tests the olfactory nerve. Yeah. What is this? Oh. I need to palpate the cervical spinous processes, which are right down in here. And then, the purpose of the water. I'm going to palpate the trachea here. And then, okay, take a small drink and swallow. Okay, the cricoid cartilage rises and falls, and it is centered. And then, take another drink. And I'm palpating the thyroid, the isthmus, and the left wing. And then go ahead and take another drink. Moving the trachea over. And palpating the thyroid, and there's no nodes no lumps and no swelling.